Assalamu alaikum. This is Namira Islam, the Executive Director of MuslimARC, the Muslim Anti-Racism Collaborative. Thank you for joining us today. In honor of National Recovery Month, MuslimARC is organizing Race and Muslim Mental Health. It's a panel to raise awareness about the intersection of mental and substance use disorders, race, and Muslim identities. This program reflects the 25th Annual Recovery Month theme, Join the Voices for Recovery, Speak Up, Reach Out, which encourages people to speak up about mental and substance use disorders and the reality of recovery. Many Muslim Americans who suffer from mental and substance use disorders struggle to find adequate care. Further, they face stigma within their ethnic and faith communities. A number are barred from gaining access to treatment due to their socioeconomic status. Others find themselves being treated by practitioners with little understanding of the social and cultural factors that shape many Muslims' lives. Access to mental health care is a racial justice issue, which is why MuslimARC is taking steps to address in our capacity as a collaborative that actively works to address racism and amplify the voices of the marginalized members of our community. So joining me today, we have three amazing panelists. I just want to introduce them to everyone, and then we can get started talking about this very interesting subject. We have Kameelah and Rashad. Kameelah is the founder of Muslim Wellness Foundation and the Interfaith Fellow and Campus Minister to the Muslim community at UPenn. She is the founder of our Muslim Wellness Foundation, is dedicated to reducing stigma associated with mental illness, addiction, and trauma, and raising awareness regarding the behavioral health care needs of American Muslims through community dialogue, education, and training. Kameelah also serves as the Interfaith Fellow and Muslim Chaplain at the University of Pennsylvania. As chaplain, Kameelah acts as a counselor and advisor to the Muslim students on campus and facilitates discussion on religious identity development and challenges faced by American Muslim youth. She also serves as a resource to the wider UPenn community and administration on Islam and Muslims. In this role, she also develops the relationship between identity, faith, and mental health, derived from over a decade of experience in family therapy, addiction, substance use treatment, and managed behavioral health care. Kameelah's general areas of interest include the role of spirituality and cultural identity in family therapy, conceptualization of wellness and community resource building, and lastly, culturally competent practices within Muslims and African American therapy. She is keenly interested in exploring the relationship between religious, cultural identity, attitudes toward counseling, and health-seeking behavior in minority and faith communities. She graduated from the University of Pennsylvania with a BA in psychology and a master's in education and psychological services, and she has pursued further graduate education, completing a second master's in restorative practices and youth counseling from the International Institute for Restorative Practices, and obtaining a postmaster's certificate in family therapy from the Philadelphia Child and Family Therapy Training Center. She's a certified instructor in adult and youth mental health first aid and a trained prepare or /enrich facilitator. Kameelah is pursuing her doctorate in clinical psychology at Chestnut Hill College in Philadelphia. We also have
That's long.
With the sister Salma Abugudeiri. Salma enjoys working with couples, individuals, and families of diverse cultural backgrounds. She believes that most people experience challenging circumstances at one time or another in their lives and can benefit from having a safe, non-judgmental, and compassionate place in which to explore issues and solutions to problems. By using a collaborative approach that is respectful of clients' values, Salma helps clients develop a more positive perspective of their lives, which enables them to discover solutions and develop new strategies for dealing with their problems. Salma uses a client-centered approach, tailoring the counseling to meet the client's needs. Salma has postgraduate training in marriage and family therapy. In addition, she has experience helping people cope with trauma, domestic violence, cultural adjustment, spiritual issues, depression, low self-esteem, and anxiety. She's also trained to provide EMDR, which is eye movement desensitization and reprocessing, for treating trauma and other issues. Salma believes that all people have the capacity to make positive changes in their lives if they're willing to take the time and effort to do so, and if they have a supportive environment in which to grow. And lastly, we have Dr. Malik Raheem, an assistant professor in the Counselor Education and Rehabilitation Department at California State University in Fresno. Dr. Raheem is a national certified counselor, approved clinical supervisor, and a licensed clinical professional counselor in the great state of Illinois. Dr. Raheem was born and raised in Chicago. He attended Chicago State University, where he earned his Bachelor of Arts in Psychology and a Master of Arts in Community Counseling. He's worked for several years in hospital and community agency settings. He worked for 4 years at River Edge Hospital, the largest psychiatric hospital in Illinois. He worked for an organization named One Hope United. And his clinical focus includes at-risk youth, adults, families in crisis, groups, and couples. He has a clinical focus on intimate partner violence, psychosocial mental health development issues, personality disorders, interpersonal relationships, group dynamics, and intergenerational trauma issues. In 2012, he completed the requirements for his doctorate in counselor education and supervision from Northern Illinois University. His research interests include ethnic and racial identity development, racial microaggressions, and racial battle fatigue. Also multiculturalism in counselor education, counseling Muslims, interpersonal relationships, personality disorders, and mental health issues with people of African descent. So as everyone can see, we have some really experienced and just very smart individuals on the panel with us today. So I'm really looking forward to exploring this topic of race and Muslim mental health with them. So I wanted to just get a general sense, what are some mental health issues that are faced by Muslim communities? And we can start with Kameelah.
Okay. Assalamu alaikum. Peace to all those who are tuning in and listening. I think, I'm glad you said Muslim communities, because often what we find is that there seems to be a monolithic community, and alhamdulillah, our community is so very diverse and represents so many different cultures and ethnic groups that sometimes that gets lost. But I think one of the major concerns that kind of spans all communities is the issue of stigma, and knowing that stigma really prevents not only people from accessing healthcare. I think it also prevents those who are suffering, even within their families, to feel confident in knowing that they'll get the support that they need. And when we know that statistics like 1 in 4 Americans are suffering from mental health illness, either anxiety, depression being the most common in any given year, only about 60 to 70%, or rather 60 to 70% of those who are experiencing a mental health challenge don't receive help. And stigma being one of the main reasons why. It could be an issue related to both religion and culture. So for example, in the African American community, it's seen as, that's almost like what white people do, is go to therapy. Black people don't need therapy. We also have a very kind of fraught history with the medical profession and psychiatry in general, so that we've been, psychiatry has been used to validate the inferiority of Black people. So there are multiple reasons, but I think stigma definitely is one of the major hurdles for those who really need the support.
Okay, great. And do you think now with accessibility to treatment, is that something that African American Muslims have good accessibility to treatment? Is that something that is an issue as well?
That's also an issue. It's the issue of stigma and kind of literacy. So what do people know about mental illness? What is it? How do you define it? But then once people are looking to seek treatment, unfortunately, many, I'm trying to think of how to phrase this, but unfortunately, there are not enough culturally competent providers, counselors, therapists who can understand the cultural elements as well as the religious elements of being a racial and religious minority, and the history of trauma in this country and oppression, that can really be able to assist in a competent manner. And so people don't want to go. They're already feeling like, oh, I don't want to go. I don't want to kind of betray my community. But then having an encounter with a therapist or a physician, a psychiatrist, that feels very uncomfortable, that feels like a lot of blaming, a lot of kind of pathologizing of things that are kind of normal responses to stress and stigma and trauma. Having those kind of uncomfortable and, frankly demeaning interactions really places another barrier. So we need more people who are kind of competent in those areas to do good therapy with people who need the help.
Okay, yeah, that makes sense. Dr. Raheem, I want to go to you next. Same question. What are some mental health issues faced by Muslim communities? And feel free to build off of what Sister Kameelah was just mentioning.
Okay. Well, Sister Kameelah kind of explained it quite well with the stigma. As far as specific issues, I would say racial microaggressions and Islamophobia, as well as trauma and stress.
Mhm.
Um, I think the stigma is a huge part as far as them being able to go get help. But as far as just some of the mental health specific things, I would say microaggressions and Islamophobia, especially with the anniversary of 9/11 just passing. You have, it's really become a bad thing to be a Muslim. So it's like the thing is that you have so many things going on as far as like ISIS, Al Qaeda, and all the anti-Islam things that's going on Fox News and in the media in general. So the thing is like those kind of things kind of wear on you, and a lot of times our community don't realize how much stress that causes them individually. Microaggressions, because the three types of microaggressions, the two I like to focus mainly on are the insults and the validation, because they're covert, and
Mhm.
that messes with their mental health, because a lot of times they start questioning, are they really seeing or hearing what they believe they're hearing? And then of course stress kills. And just being a person of color in this society is a stressful thing within itself. But then you add that component on there of being a Muslim, or especially a Muslima, that kind of stressors, really causes a lot of problems. And a lot of us, like so Kameelah said, the stigma of mental health, as far as going out and seeking help, we don't go do that. And
Mhm.
then, I think a lot of us are suffering from, different levels of trauma. So, I felt you put all those factors together. I think those are some of the big mental health concerns that's facing the Muslim community today.
Okay, and could you explain a little bit what microaggressions are? Maybe provide some examples of
Why
what
did I
is a
know you?
microaggression?
Why did I know you were going to pick on me today? Why did I know you were going to pick? Microaggressions. The funny thing is microaggressions can take many different forms. They could be gender microaggression, they could be sexual orientation microaggression, they could be racial microaggressions. Um, but for this discussion, I'm going to talk about racial microaggressions, and what they basically are like commonplace verbal or behavioral indignities that, whether they're intentional or unintentional, cause the common person to feel that they are being communicated hostile, or they're getting derogatory messages or a negative racial slight or insult. And there are basically like three types. There's the micro assault, which is very overt, where the person is what they're communicating. They might call you the N word. They might call you a terrorist, or stuff like that. Those type of things, what the person's intentions are. So it's no really subtleties to that. The micro insults or the micro invalidations are more covert, and I think those cause more mental health issues, because it has the person questioning, on whether they're being too sensitive. Sometimes when they talk to
Mhm.
someone who doesn't understand the concept of microaggression, they might try to tell them that they're being too sensitive. But the micro insult and micro invalidations, they usually talk about the ascription of intelligence, making them a second class citizen, making their communication style inferior type of communication style, making a pathology as part of their communication style, or like an assumption of criminal status. It also talks about making a person feel like an alien in their own land. Persons talking about how they're colorblind, or they deny their own individual racism, or the whole thing about the myth of mediocrity, where they kind of like try to make race not a factor in any of the issues.
Yeah.
Okay, yeah, that's a great explanation.
And I
Kameelah,
think
you
what's
wanted to
so,
add? Yeah.
yeah, I think what's so, I guess, difficult about especially the covert forms of those microaggressions is that it almost feels very surreal. You
Yes.
know, if you're a woman who's covered, if you're a person of color, and something happens, you think like, wait, did that really just happen to me? You know, and you're looking for people to kind of validate your experience. But if everyone around you is feeling like, oh no, you're being too sensitive, that didn't really happen, they didn't mean that, so the times that I've been stopped or profiled on trains, on airplanes, you think, well, maybe they're just randomly stopping everybody, or perhaps there's a particular reason why I'm being stopped. So, you know, it almost causes you to question your perceptions of reality, and the things that you're feeling, which are legitimate.
Right, right. And Sister Salma, working with, are your patients Muslim, non-Muslim? Do you see any differences with how the type of issues that Muslim patients will come in with, as opposed to non-Muslim patients?
Well, so the majority of my clients are Muslim. I would say 99%. Can you hear me okay? Or is
Yeah.
there echo? Okay, I'm hearing myself echo. So 99%. I really can only speak comfortably about working with the Muslim community, because that's what I've been doing for the past 20 years. But I agree with both of you who have spoken so far. I work primarily with the immigrant Muslim community, as well as the convert community, but mostly immigrant Muslims. And I think that there's a lot of within group discrimination for people who either have mental health issues or choose to seek counseling because of the beliefs that we have, oftentimes within the Muslim communities, the beliefs that if you are suffering from depression or anxiety, then you're not a good enough Muslim, or so there is a struggle that people have within themselves to be able to just to articulate that they have a mental health issue, and that and in seeking help, there's quite a bit of shame. And I think that we can tend to see a lot of judging happening, and there's again, it's linked to, unfortunately, misconceptions about mental illness somehow being a reflection of a lack of faith. But then once people do seek treatment, I often see clients after they've been to therapists who are not Muslim. They may be of other faith, they may be totally secular, and the complaints are that, I think it is more along the lines of these microaggressions. But what they say, of course, is they don't feel understood, or they feel like the therapy is pushing values that are contradictory to their own, even though the therapists may not be intending to do that. So I also do a lot of cultural competency training for therapists. Okay. And so when I work with the therapist, it's just very interesting, because out of a lack of understanding Muslim values, the comments or the way that questions are framed are often quite insulting to Muslims. So something, for example, it could feel very benign to the therapist, but so if the parent just happens to mention that they're having, maybe the struggle with their teenager is because they won't let them go to the prom because they didn't feel like that was appropriate for a Muslim, and then the therapist says, "Oh, I can't believe your son or daughter isn't going to get to go to the prom." So right there and then, a whole lot has just happened to validate and alienate that parent. Oftentimes, unfortunately, that the teenager is still there in the room. And so now what happens is the parent decides, oh, we can't come to this therapist anymore. And therapy ends prematurely, unfortunately. And then people are afraid to go back into therapy again for a long time. Or maybe there's another crisis until they build up the courage to try again. And many Muslims don't know that there are a lot of Muslim mental health professionals. And of course, in some areas in the country, there aren't Muslim mental health professionals. So there's actually a lot, I think, of issues that limit people's seeking therapy as needed, or as much as they could possibly benefit from it.
Right. So I guess I want to explore that a little bit more, this idea of Muslim therapists versus non-Muslim therapists, and maybe the types of problems that you'll have with even Muslim therapists when it comes to of other ethnicities or other backgrounds. So with non-Muslim therapists, you just have this general sense of their microaggressions, Islamophobic comments perhaps, something along those lines. When it comes to Muslim therapists, what are your thoughts on whether, I guess, like Muslims should be seeking Muslims of the same background? Are there enough therapists with confidentiality issues, possibly, or you end up going to someone who either is a friend of a friend or something along those lines? Like, does that come up at all, and how do you possibly handle that? And Sister Salma, we'll go back to you and then go to the other two panelists.
Okay, well, that was a lot of questions, but
yes, it
was. there are definitely a lot of challenges. First of all, let me back up. I don't necessarily believe that if you're Muslim, you can only benefit from a Muslim therapist.
Okay.
I just don't believe that at all. I think that you do have to do some screening to find a therapist who's culturally competent. And that might mean meeting with multiple therapists until you find somebody who gets it and who's been outside of their, city limits far enough to have some experience with other cultures. But then just because we're working with somebody from the same faith background doesn't mean that we are all sharing the same values. So I think sometimes my clients, for example, they see me, I'm a Muslim woman who wears hijab, they make a lot of assumptions about me. They make some assumptions that I share, some values. For example, men will sometimes bring their wives in and they'll be like, Sister Salma, we really need you to teach our wife that she has to be obedient. And I'm like, well, first of all, that's not what therapists do, but second of all, maybe you should have interviewed me first, because that's just not my thing. So there are a lot of assumptions made by clients that just because we're Muslim, we're automatically understanding them. And sometimes clients will, they want to take shortcuts, so they'll say, well, you know how it is. Yeah. And I have to say, no, I actually don't know how it is for you. Mm-hmm. So there are these attempts to shortcut. And then for me, as a person who's worked in the Muslim community, in the same Muslim community for 20 years, there are things that are unavoidable, like dual relationships. And I mean, I go to weddings, and sometimes there are a lot of people that are also my clients. And so it can get tricky sometimes to navigate. And I think for clients, I always try to have conversations with them about what that's going to be like for them. But it can also be difficult because on the one hand, they want to go see somebody that they really trust, and because they know you, they trust you. But on the other hand, then it really can become very awkward. Somebody just told me, man, you know too much about our community. Yeah, I know a lot about the community. And so people sometimes feel, a little self-conscious about that when they're outside the therapy room. So there are some particular challenges. In terms of being able to find a Muslim who is, very aligned with you, number one, we don't have enough therapists, but number two, I don't really think it's necessary, because a good culturally competent therapist doesn't have to share your values, doesn't have to have identical values to you or be of the same ethnicity. But we do have to have, that cultural competency piece, which is mandatory for all therapists. Not all therapists go and get that piece, but we're all supposed to. Yeah.
Okay, so Sister Kameelah, let me go to you now. With this idea of training, cultural competency training, do you think maybe Muslim therapists need a different kind of slightly different version, possibly, given the diversity within Muslim communities?
Yeah, I think it's important that even for a Muslim therapist who identifies as such, I mean, there are some counselors who, do not put that forth as their primary identity, and don't want to be kind of advertised as a, quote, Muslim therapist, because they may limit, who they can engage with and, other reasons. But I think, it's also important for, we talk about kind of person of the therapist. So how do I understand myself? Before I even go into a counseling relationship with someone else. I mean, I think as Sister Salma said, when people take those shortcuts and they say, well, it's like, well, I'm from Brooklyn, New York, I'm a child of converts, born and raised Muslim. That may be very different from someone who's a child of immigrants. There may be some similarities, but also a lot of differences. And I think, we may also not understand sectarian differences. So if I identify as Sunni, am I able to actually competently, understand the concerns of a Muslim who's Shia or who's Sufi, or who doesn't identify at all, who may not feel comfortable with saying, yeah, I'm, this is my level of religiosity. And I think what starts to happen, especially if you're a woman who covers, you're going to make certain assumptions right off the bat about my level of practice, my level of religiosity, my, kind of values and orientation. So for some, that helps the therapeutic alliance. It helps build a rapport very quickly. But I also would have to challenge, those that I'm working with to say, you have to tell me what your experience is like. You have to tell me what your understanding of Islam is, and how that intersects with either your understanding of the problem that you have, or using Islam as a way to heal, through whatever challenge you're facing. So I think, when it comes to understanding those nuances within the Muslim community, we have to be very careful about knowing what are our blanket assumptions. What do we automatically kind of, what is our frame of reference, and how do we kind of apply that frame of reference to our clients? And sometimes that can do a real disservice to them.
Okay. So, Brother Malik, when it comes to microaggressions, I guess, have you seen any trainings on how possibly a therapist could avoid microaggressions, or any training on those lines to give people more competency in that regard when they're talking to their clients, that to avoid using racial microaggressions or any other microaggressions?
There are trainings out there. There's a lot of research articles, but I think Sister Salma and Sister Kameelah made good points on the counselor being multicultural competent, first of all, and then Sister Kameelah made an excellent point of knowing your own, know thyself as a counselor,
Right.
So knowing your own biases and being aware of your biases and accepting your biases and working on your biases and doing personal counseling yourself as a counselor and a mental health professional to get over those biases. So I think those are some of the most important things as mental health professionals that we can do to try to ensure that we don't have microaggressions while we're in counseling, because they do happen. I think it was Sister Salma who said that she's a client-centered, focused mental health professional, and usually that kind of, makes the possibility of racial microaggressions go down, because she's putting the clients first, and the client's the expert on their life. And I heard Sister Kameelah say something very important, in which she said that she have the client, make sure that they tell them, she says, I want to understand your perspective. And so by doing that, that helps eliminate some of the possibilities of microaggression. I mean, they're going to happen, but one of the things I do tell my students, as I'm because as a counselor educator, I train people to become counselors. One of the things I tell them is the invitation for repair, because a lot of the clients of color, they accept you as the expert. So it's like they have a fear of correcting you. But with the invitation for repair, and Sister Kameelah was kind of getting onto that, is you letting them know it's okay if I'm not understanding your perspective, for you to help me focus, because these therapeutic 50 minutes is all about you. Right. So I want to understand your perspective. So it's like, and not, as a counselor, if it is a racial microaggression and your client brings that up, not to get defensive. And not to try to, blow it off like, oh, well, that's not what I was trying to do. You're misunderstanding me. To accept it and understand that it's your client's perspective, and you have that as a therapeutic tool to work on. Okay, well, how can I do better? Let me talk about that. Let's talk about that a little bit more, and getting into it and making your client feel that a sense of safety in there, to where they really can talk about anything, even if it's, correcting the therapist or the counselor, the mental health professional. So it's like those are some of the things that as a counselor educator I try to train my master students on, that sometimes, unfortunately, racial microaggressions in sessions can happen, but understanding, know thyself as a counselor, and being willing to understand your biases, work on your biases by going to get counseling yourself on a regular basis, because even if it's not about microaggressions, as a mental health professional, wellness is something that we really need to look into, because of the fact that you're accepting other people's issues, and that weighs on you. So you got to have wellness yourself. And when it comes to microaggressions, to not try to be defensive and say, oh, that's not what I meant, because that's going to, next thing you know, you're going to lose a client, because they're not going to feel comfortable coming back. So the thing is, I ain't necessarily saying own up to it, but, express it and have it as a therapeutic tool and working on it. Because it's like, the thing about it is this, is your client can be very, very sensitive because the accumulation of racial microaggressions can have a sense of like a battle fatigue, to where it's like they feel that their race is always an issue. So they're coming out and they're, you know, and they see different things and they're picking up on different things. And like I like to tell my counselors that out of all the superheroes, you know, you got to understand that Spider-Man's the most, you know, the one that you need to focus on, because Spider-Man has a spider senses. And that's how racial microaggressions are. You know, you have those spider senses like, oh, here it come again. So you got to be aware of that. So that's go ahead.
Yeah, and I think that speaks to you know, kind of a related issue, is that as in the community, we do have a growing kind of Muslim mental health professional community. That
was going to be my next question, actually.
Yeah.
So I was about to ask, like, is there such a thing as Muslim mental health?
Yeah.
What does it mean? Yeah.
I think, you know, it speaks to sort of the need for professionalization of, you know, this movement, so that, you know, if anyone can say, well, oh yeah, I do counseling for Muslims. Well, just like with any other field, we would expect that person to have a certain level of education, of ongoing education, of certification, something that which validates that, you know, they have been trained properly, because this is a very intimate relationship that you're embarking on with someone, you know, and with a stranger. So you want to feel that you know, you're doing it with someone who, you know, has ongoing supervision, ongoing education and training, and that they're constantly in the process of, you know, self-reflection and kind of critical self-awareness, so that they can recognize when they are committing those microaggressions, or just do not have a level of competency to deal with certain issues that a client may present with. So when I think when we talk about Muslim mental health, you know, kind of a resurgence of that term kind of after 9/11. So looking at sort of this post 9/11 anxiety, depression, how are Muslims dealing with discrimination? Sometimes I feel like that's sort of an artificial demarcation, because there are people like Sister Salma who's been working, you know, in the field for decades, that can say, you know, there's always been this tension between, you know, American identity, Muslim identity, racial identity, and you know, we're kind of dealing with double and triple and quadruple consciousness at some points, you know. So what does it feel like for me being, you know, an African-American Muslim woman who grew up in a poor neighborhood, you know? So you're adding a layer of, you know, kind of the trauma of poverty and of oppression to understanding yourself. But I think with the term Muslim mental health is getting at, we have to recognize that we have a unique experience. You know, and if we're only applying kind of psychological models or understandings of our experience from a very different, often very Western perspective, we may come out looking very damaged, you know, depending on a counselor's orientation, and that may, you know, pathologize some of the ways in which we're trying to cope with, you know, our existence here, you know, and particularly in this climate and kind of international and national conflict. So I think it is a very real term, and we have to, again, always use the multiple, say, Muslim communities, because you have, you know, Arab communities, South Asian, indigenous Muslim, African-American Muslim communities, and we're coming with, you know, different histories and levels of engagement as far as citizenship is concerned. But for those who want to kind of become a part of like a Muslim mental health movement, I think it's important that there are some boundaries around professionalism, some expectations that, you know, just like any other field, if you go to your family physician, you would certainly expect that this person to be at least board certified, to have completed medical school. You know, you would ask for all of those qualifications. So there's no reason why someone who's seeking, particularly a Muslim therapist, shouldn't also ask, you know, how were you trained? What's your orientation? Where did you go to school? I think that's part of sort of the interviewing process that Sister Salma mentioned.
Sister Salma, since you have been working, you mentioned, you know, nearly 2 decades, have you noticed a difference in the type of issues that maybe Muslim clients come in after 9/11 versus before? Or are some of these issues like depression and anxiety, I guess, what is the impact of Islamophobia on these issues? Have you seen a difference in that front?
So I would say yes and no.
Okay.
No, in the sense that, identity issues have always been identity issues, right? And there's always been something happening globally that has affected Muslims. So if we go back to when I was a kid, for example, the Iranian hostage crisis, right? So that affected Muslims that were in the United States during the Iranian hostage crisis, the Gulf War, all of these things that the Palestinian-Israeli conflict has been going on forever. I mean, so these things have always happened. So I agree with Sister Kameelah. I mean, in a way, it's an artificial demarcation. So the issues that we have been facing, in some ways are the same. One of the differences I see is that within Muslims, the understanding about what mental health is and the willingness to seek help has certainly, increased. So that's something very positive. I've also seen, I have seen both a positive and a negative shift at the same time within the general therapist community in terms of how Muslims are viewed. So I've been doing cultural competency trainings also from just about the time I started practicing as a therapist. And so it's been interesting to me that one of the exercises I do with therapists is just in the very beginning I ask them to, I present I take them through like a visualization of a Muslim family, and depending on my mood, I describe the family in different ways. But then I ask them to just, shout out the first thought or the first emotion that comes to them. And it's, the range is pretty incredible, but it's interesting to me that post 9/11, I feel like there are more therapists who are actually culturally competent. They have less, it's a little bit interesting, less fears about working with Muslims, like less anxieties about the Muslim client themselves, and more anxiety about offending. They don't want to be offensive. So their anxiety sometimes, anxiety kind of restrains us sometimes, or we overcompensate. But they're so careful that they don't want to say anything offensive because they understand that Muslims have been victimized as well, just because of the backlash after 9/11, and they also, I think that there's an awareness of the profiling and the things that Muslims go through, and so they want to be very sensitive not to add another layer of trauma. But there's also a lot of confusion, so we don't really understand, people, because when I talk about Islam, people will say, oh, is that like your personalized version of Islam? It sounds really nice.
Oh boy.
So it's both and, I don't think it's just, I don't know what it depends on, what particular group or day of the week it is, or I don't know what it is. It's both. I see positive and negative.
Okay, that's really interesting. I think one of the questions we had too was sort of whether, I guess, mental health, like the field with 9/11 and Islamophobia, whether that's become sort of a defining issue for Muslim clients, or has focus shifted away from socioeconomic impacts at all, or no?
So from the client's perspective, that's not what's being articulated.
Okay.
People aren't coming in and saying, I'm experiencing this because of, post 9/11 events. That's not how people define what they're experiencing. Certainly in the literature we see this demarcation and a lot of research being given to post 9/11 phenomena, but clients don't generally link things, at least not the ones I've worked with. They don't identify that this is a post 9/11 kind of issue.
Okay. Sister Kameelah or Brother Raheem?
I think something that's also kind of emerging in the field is a level of comfort, or even just asking the question about spirituality and religion within the counseling context. When I trained in my first master's, I don't think we talked about religion. You know, it was seen as like, well, you know, as a therapist, you don't want to impose your beliefs on someone. So it was just something that wasn't talked about. And I think, you know, over the years, I've seen that there's, you know, kind of slowly but surely, maybe it's just even a curiosity about the way in which people make meaning of their suffering, you know, from a religious or spiritual perspective. So if I come to a therapist and I say, well, I think I'm being punished by God because I've done something wrong, I feel very guilty about it, you know, perhaps this is just a punishment because I've been a bad Muslim. The therapist has to be able to work within that person's perspective instead of saying, well, that's ridiculous. Why are you feel like you're being punished? You know, but that would necessitate the counselor understanding that within the Islamic tradition, there is, you know, talk about expiation of sin and of, you know, kind of patiently persevering and of forbearance. So how does that perspective impact even how someone will approach the mental illness? But I think recently there's been an acknowledgement and kind of a positive acknowledgement of the role of spirituality in healing. So if that is kind of an area that someone wants to explore, the therapist has to know whether or not that falls outside of their limit. If they are personally uncomfortable, perhaps they're atheists, so they don't want to talk about a higher power or a being that's kind of impacting this person. So again, I think that goes back to the competency of the therapist. But there's, I think also in terms of religion and counselors, whether or not the clients feel that they can disclose those things that are related to religion because they don't want to betray the community. So, you know, definitely people of color feel this way. So, you know, I've had women come to me and say, well, I told, you know, my therapist that, you know, perhaps I was experiencing domestic violence in my home. And she automatically thought, well, it's because marriages are very oppressive in Islam. So, or perhaps you're, you know, having such a difficult time because you're covered, or perhaps because you're not covered. And so how do you see yourself as a woman? And the client may believe, you know, or come into therapy saying, well, I'm depressed. It's not because I wear hijab. That's not the reason. So I think it's, you know, both that there's a push towards understanding the role of spirituality within the counseling context, but that within the Muslim community, I've just seen so many of my clients just say, I don't want to tell a non-Muslim because that'll just validate all of the horrible stereotypes they have about Muslims, and that feels like a betrayal.
Absolutely. And that's something that, I mean, I work in legal services, so as an attorney, I've seen that with my Muslim clients as well when they walk in, and it's a legal problem, and then they'll say, it's nice that it's a Muslim, you know, you're not blaming the domestic violence or the marriage I'm leaving on my religion. Dr. Raheem, you know, this point that Sister Kameelah brought up about this idea of patiently persevering and that being part of our faith, when it comes to racial microaggressions, now how does that impact, you know, do people sort of see the microracial aggression, you experience that, and then is there that kind of feeling that I need to patiently persevere in this front, I don't have to deal with it from a mental health perspective? What is that interaction like?
Ooh, wow.
Good question.
Yeah, I didn't see that one coming. Wow. You are a lawyer, aren't you?
I'm trying to keep it interesting, yep.
Okay, let me see if I can answer this. The accumulation of racial microaggressions, especially the covert kind, are really damaging to the person's mental health. And usually the accumulation of racial microaggression is usually the onset of what they call racial battle fatigue. And what racial battle fatigue is the constant feeling that you're at war because of your race. And you wake up in the morning stressed out because you almost see the battle coming. And so it's like it's quite similar to what they would call PTSD, to where one little incident would take you back, and you will keep reliving these type of incidents over and over again. So you'll see a lot of things like frustration, anger, exhaustion, physical avoidance of certain situations, psychological withdrawal. So it's like that's usually what racial battle fatigue is. So it's like usually if it's a lot of accumulation of racial microaggressions happening with a person, what you'll find is that accumulation will usually start having incidents where sometimes you'll see outbursts that don't match the situation because they have anger issues. You know what I'm saying? Because they've been holding all this stuff inside. And it's like it's this constant battle. Like Sister Kameelah said, they're living different consciousness because they're trying to figure out: am I really seeing this? Am I being too sensitive? Why nobody else can understand this? And so usually you will see outbursts that's like that really doesn't have any, you might say don't have anything to do with the situation, but because of the built up anxiety, the anger, you might have outbursts. And I I I would really like it if no one tried to be resilient and persevere if they're suffering through microaggressions, because it can lead to more serious, complicated issues with battle fatigue and stress as in a whole. So it's like if they are, dealing with what they feel is an over accumulation of microaggression, I would really encourage them to see a mental health professional. And it's just like Sister Salma said, mental health professional doesn't have to necessarily be a Muslim or a non-Muslim, as long as they're culturally competent and that they have a clear line of ethics and professionalism to them. So it's like that's what I really encourage. But I would really say, as far as the resilience and trying to persevere through racial microaggressions, I would not encourage that. I really.
You know what? But there is, I think, this sort of like mystique or piety around suffering, so that if someone is able to endure and, the person or the woman that everyone looks at, it's like, oh, mashallah, she's been through so much, but she's so strong. We haven't seen, she's been able to kind of take everything and, sort of roll with the punches. We do sort of place those people on a pedestal. It goes back to, the myth of the strong black woman, of the Muslim wife that's just, she's always stoic, she supports her husband, she doesn't complain. You have men who may be depressed, but it comes out as being very irritable, angry, frustrated, and kind of lashing out at maybe children or the wife. So we do have this idea that we should, only take our concerns to Allah subhanahu wa ta'ala, that's it. That we, need to show gratitude, that it's not worse, that we need to kind of, demonstrate a level of humility and, and often people say, well, Allah knows best. And I say, well, Allah also said that there's certain actions that you need to take in order to help, alleviate a negative situation. So it becomes almost this like, mashallah, like a lot of fatalism, well, Allah knows best, Allahu alam, I'll just, leave it in Allah's hands. And it's like, well, we saw our Prophet be very proactive, about getting through certain situations. And when he also says, tie your camel, and I talk about this with my clients as well. Yes, you pray. I tell them, check all of the above. You pray, you ask people to make dua for you, and you seek the help of a counselor. Maybe you need a nutritionist. Maybe you need to kind of get on an exercise routine, change your diet, all of the above. But it's always kind of this idea, this of the person who just, they're mashallah, they're like a rock. Everyone can rely on them and support them. And it's usually that person that's probably holding all of their symptoms in their body. They have a high level of stress, it's high blood pressure, because they're not feeling like they can articulate, some of those concerns.
And I think a lot of times people are not even aware that they're being mistreated. When people are used to it all the time, they don't even recognize that there has been an aggression of any sort. And for the immigrant Muslim community, if they're seeking any kind of treatment and they view the therapist as the authority, there's a lot of cultural taboos about challenging the authority. or even articulating that they feel like they've been offended. So they'll just quit, as opposed to saying, I found that very offensive, or maybe you didn't mean it, but I actually was insulted. But even that, for a lot of my immigrant clients, that would really be way too much. And that's just cultural values of not challenging authority. It feels like it's being disrespectful, ungrateful, and so they'll just unfortunately terminate.
Yeah.
But that's one of the reasons I think microaggressions are so mentally healthy, as far as causing so much damage and mental health issues with Muslims, because of the fact, just like Sister Samila said and Sister Kameelah said, Sister Salma and Sister Kameelah said, excuse me, is that, you do have people that want to persevere and be resilient. And, it might be certain situations where that is good, but when it comes to microaggressions, those accumulations, that stress, I don't encourage it. And Sister Selma said, very well, that sometimes the cultural reasons people will just blow it off and just try to ignore it and hold on to certain things and just not confront it. I still would encourage anyone listening to this, as best you can, to find someone to talk to. And like Sister Kameelah said, some people rely on lots of Panelist, and that's the best of all people, best of all things to rely on. But a lot bring mental health professionals for a reason. So it's like, so we're here to help the community, in a whole. So I would encourage everyone to really look into, making sure that their mental health is wellness, because, there's a big difference between mental health and mental illness, because just because you have a mental health issue don't mean it's mental illness, because you don't necessarily have to be diagnosed with anything. And usually with mental illness, you're diagnosed, but mental health can be something, like stress. So it could be trauma, because it's like, the thing about it is like, you can have a death in the family, and that can cause mental health concerns, not a mental illness, where you don't have something diagnosable, but it could cause a mental health thing. You might fail a test. You know what I'm saying? You might be taking a test and you might fail a test. That could cause, the blues, not depression, but the blues, and that weighs on you. Or you can be holding all this stuff in because your child is playing football and they're losing.
It might be a little dig at me, but
you can't get out there and help them. So I read Facebook.
Yeah.
But
now,
like,
when it comes, oh, go ahead.
No, I that was pretty much done. I was rambling.
Okay. Yeah, no, I guess my question too is, when it comes to microaggressions, you're mentioning this battle fatigue. Now, what impact can that have on the community altogether? Because if certain individuals are facing this kind of microaggression battle fatigue, what does that do to the community overall? And Dr. Raheem, if you want to start, or Sister Kameelah, or...
I think that starts to diminish our capacity, to really build strong, healthy, vibrant communities, because each individual and family, one, may feel like they're the only ones, kind of suffering in this way. But it also depletes so much of our energy, kind of our spiritual energy, our ability to focus and concentrate, our ability to work, collaboratively. So I think it really starts to drain our potential, when it goes unaddressed, and I think may even reinforce some of those divisions, because everyone feels like, well, I only have enough for me and for my family or for my particular masajid. I don't have enough energy for everybody else's problems. So I think it's important to know that even when, an individual is suffering from, like Dr. Raheem said, even if it's a mental health issue, just around emotional well-being, it's important to understand that it has a ripple effect, so that if it's a mother who's, perhaps feeling depressed, that has an impact on the child, that has an impact on, kind of the school environment. So it can't be seen as like, well, that person needs to go and get themselves fixed, because there's kind of a level of responsibility that I think communities should share, and one, creating a culture where people can feel that they're supported, in the same way that someone may disclose a physical illness, people check in, they send cards, I hope you're feeling well. But when it comes to a mental health issue, people hide, it's secret, they use a lot of euphemisms. So we have to, our challenge is to develop a culture where people, are able to really feel that they're going to be embraced, that we're all imperfect. But there's a level of compassion that's given, so that person doesn't have to really struggle alone, through so many difficulties.
Let me throw a monkey wrench in there, and I'm sorry for stepping on you, Sister Selma, but I swear I'll be quick. I'll be quick. I won't ramble this time. The sense of spiritual belonging, and when I say the sense of spiritual belonging it's like, I know we've had many of conversations about anti-racism campaigns in the masjids. Mm-hmm. And so, like, if you don't have a sense of belonging, a spiritual belonging inside the masjid, because you're suffering from microaggressions and they accumulate, and now you're suffering from battle fatigue in the masjid and the so-called Muslim community, you might withdraw altogether from the Muslim community. Mm-hmm. And so you start finding Muslims that are becoming unmosque, as they call it, where they won't even go to the mosque anymore. So that weakens our ummah, to where you don't have the full array of their creativity and their efforts to be able to build us up and make us even stronger. So it's like, it's things like that that can really, really affect the whole community as a whole. And then is the whole, I'm just going to be quick. It's the whole thing of where possibly the imams or the leaders of the community would put, we're not doing anything. We're not doing anything. So that spiritual sense of belonging is lacking, in some communities, to where it's like the person would withdraw and just pull away and then become a mosque. And then if you have enough of that, then it really weakens the ummah. Okay, I'm done. I'm sorry, Sister Salma.
Oh, you're totally fine.
Sister Salma, any thoughts on that part of the community impact of these kind of issues?
I think it just adds another layer to the many layers that people just have to work through. Since you mentioned the imams, I just wanted to say on the sort of on a hopeful note, inshallah, that I think that one of the things that I've been really keen on is seeing collaboration between mental health professionals and imams, and I think that we're actually moving closer in that direction. In some communities that's actually happening. I think the work that you're doing, Sister Kameelah, is certainly helping imams to recognize their limits, the limits of their expertise, and when they may need to bring somebody else in. I just, before I got on the call, finished a day-long imam workshop on domestic violence prevention. And so we also really promote that model of working collaboratively with mental health professionals and other experts, because in that way our clients, the Muslim clients, are going to feel held and supported. Yes. As opposed to what I used to struggle with more, and it still happens, is if a client overcomes all their obstacles, comes to see me, then they also go see their imam. The imam gives them completely opposite recommendations, like, no, you don't need to actually see a psychiatrist, and you don't need to go for weekly therapy. This is, doesn't make sense. That's not an Islamic thing to do. So now I'm seeing more and more support, get more referrals from imams.
Great.
So I think that's a positive change that's been happening.
Absolutely. And on that note, we're almost out of time. It went really fast. But I wanted to ask Sister Kameelah and then Brother Malik as well. I guess one thing that you're also working on right now, and one thing that you'd like to see happen within, because as Sister Salma mentioned, with imams working closer together, one thing that you'd also like to see happen. So, Brother Raheem, we can start with you.
I'm trying to become a more active member of MuslimARC.
Okay, great. Always like to hear that.
And a short-term, long-term project is trying to open up a couple of mental health centers, at least one in Chicago. Even though I'm in Fresno, I have a lot of people that are that are mental health professionals that are Muslims that I'm trying to work with to open up a mental health center in Chicago. There's a couple of imams that I know that are in Chicago that I'm sure that I'm gonna be able to touch to them and talk to them about some of the services, because I think a lot of things that are happening in Chicago, the Muslim community have been kind of left out, and I think that we offer just as good of a solution as any other community as some of the things that are being happening. And so it's like I really am trying to work and plan those things out with the next year or so. But in the immediate is, of course, being more of an active member in MuslimARC, and I'm currently the faculty advisor at Fresno State Muslim Student Association. So I'm trying to make sure that they understand the importance of mental health and wellness.
Great, wonderful. And Sister Kameelah, we'll close it out on you. One thing that you would like, that you're working on, and then also something that you'd like to be, see more of in the coming years.
I actually in DC on September 27th offering a mental health first aid training for imams and community leaders, and that's going to happen at El Hibri Foundation. And it really is, as the name suggests, first aid. How do you get people to recognize the signs and symptoms of common disorders, but also how do you deal with someone who's in an emotional crisis? You may not always have access to a counselor, but at the very least, we can teach people good listening skills. How do you reassure someone without minimizing kind of the severity of what they're feeling? And then also, how do you suggest self-help strategies, counseling, support? And, imams have really responded well to this training because they see that, one, there are professionals who train in this area and they can support. But I think it also allows them to understand kind of the limits of their office, of the imam, and that cooperation is always going to be most beneficial. So that several trainings that I'm doing starting in DC the end of this month. But like Malik said, I would love to see wellness centers for Muslims. I would love to see kind of American Muslim like mental health care network, so that someone can say, I'm in DC, but I'm moving to Texas. Like, how would I get plugged in? I want to continue therapy. Who would you recommend? That could be a network that begins online, but that there are actually kind of brick and mortar places that people can go, and not just for Muslims, but that can incorporate kind of Islamic spirituality and our understand of holistic perspective to health. So that's what I would love to see if I had a $1 billion.
Right.
But start small.
Right. Well, jazakallah khair to all of you. This has been really, really interesting. And, MuslimARC, we're hoping to follow up more on this topic, too, and just delving more into it, getting some of the details worked out, exploring just the topic more. So, inshallah, we'll see some more developments, like you all have mentioned. So, but again, jazakallah khair to all three of you for being here, for sharing your experience and your thoughts on this and dealing with my questions and all of that. And anybody watching now or later, it will be recorded and available on our MuslimARC YouTube page. And our website is just www.muslimarc.org. So, visit us on there, and we will have a page on mental health resources that we'll try and compile as well. Excellent. So, yes. Again, jazakallah khair.
Thank you so much.
My pleasure.
Assalamu alaikum.